Coronavirus disease, most commonly known as COVID-19, is an infectious disease that started in Wuhan, China, last year of December. The virus enters the body through the mucous membranes that line your nose, mouth, and eyes. The virus enters a healthy blood cell and uses the cell to make new virus parts. It multiplies and infect nearby cells. One can become infected by coming into close contact with a person who has COVID-19. COVID-19 is primarily spread from person to person. One can become infected by respiratory droplets when an infected person coughs, sneezes, and talks. One may also get it by touching a surface or object that has the virus on it, and by touching mouth, nose, or eyes. Common symptoms are coughing, sneezing, fever, and fatigue. Symptoms may take up to 14 days to appear after exposure to the virus. Most people infected with COVID-19 virus experience mild to moderate respiratory illness and recover without requiring special treatment. However, older adults and people with underlying medical conditions such as asthma, cardiovascular disease, diabetes, and cancer may be at high risk. To prevent and protect ourselves, we should wash our hands regularly or use alcohol or sanitizer. Stop touching our faces, especially the eyes, mouth, and nose. Stay at least 6 feet away from each other. And when sneezing, instead of using your hands, use your elbows to cover when you're sneezing. Stay home as much as possible. But if one is needed to go outside, one must wear a face mask, if possible and necessary, as well as a jacket, pants, pair of shoes, and gloves. We must do our part as an individual and remember that despite of what we are going through, hope is being able to see that there is light despite to all of the darkness.